back exclusively on the YouTube channel with your listener questions. Let's get right to them. Question one comes from Samantha in Vancouver, British Columbia, Canada. What a beautiful part of the world. Brian, you've covered a lot of ground on alternative medicine and health innovations in previous seasons. Which of those practices or ideas have you actually incorporated into your own daily health routine? Well, Samantha, thank you for the question and the concern. I have not had any major health issues, knock on wood. So fortunately, I haven't had to spend a lot of time focused on interventions, medications, or major medical procedures. So thankfully, I haven't had to spend too much time on this topic. What I can say is that I am a regular visitor to my primary care physician. I routinely get screenings for any number of issues. I have a very clear view of my family history. So when the time comes for any of those things to become a concern for me, I certainly will be trusting my primary care physicians here in the United States with preliminary advice, counsel, treatment options. But I will certainly keep alternative medicine and health innovations top of mind. And fortunately, I have selected a physician who keeps those things in mind as well. Doesn't write things off as, being not evidence-based or having no background or having no value to any individual. It's a much more it's an exchange of ideas kind of relationship with my physician providing what I would consider to be the best available counsel and advice based on their experience, but being open-minded that there may be things that work for me that don't work for the average person, and we can explore those, and we would do that together. So thank you for the question. I'd love to hear, Samantha, from you or from anybody else about the impact of those shows that have had on you and how you think about your healthcare. The whole point of those programs was simply to talk about some of the alternative medicine options that are out there. And really, this was about the trend of more and more people getting frustrated with traditional evidence-based Western medicine, especially in the post-COVID era, and looking for alternatives to pharmaceuticals and to major medical interventions in the Western healthcare model. So that trend continues. We'd love to pick it up. And the fact that we got questions on it means maybe it's time for us to cover that topic again. All right, the second question comes from James in Manchester in the United Kingdom. James asks, also on the health trend topic, you often talk about big picture health trends, but on a personal level, how do you balance modern medicine with lifestyle choices like diet, exercise, and mindfulness? Again, thank you for the specific question. What I can tell you is I try to focus as much as I can on the things that I can control. Diet and exercise is about as fundamental as it gets. When it comes to diet, look, I'm not a spring chicken anymore. I'm not as young as I used to be, so I'm much more mindful of the things that I eat and the amounts that I eat and the amount of exercise that I do to burn some of that. I can definitely tell you from a mental health perspective, my focus is always on ensuring that I'm aware of my stress levels, that I'm aware of my relationships and how those are affecting me. I try to step away from the computer, step away from screen time, step away from media and social media, even though I'm a news junkie, and just spend some time away from that and out taking a walk, out in nature, spending time with my family, even my friends, coworkers, colleagues, anybody that I can spend time with that doesn't require me to be in front of a screen. I try to get as much of that time as possible. So I try to practice. I don't preach on healthcare, but I try to practice all the things that you've heard us talk about on this program around taking care of what you can take care of yourself. And the one thing I would say to anybody who has questions about, at a personal level, how do you think about your health? Nobody knows your health like you, but you have to get really in tune with your body and pay attention to the aches and the pains. Pay attention to the things that might be annoying to you, but you don't really get to the root cause of them. Pay attention to those things that you might pop a quick anti-inflammatory pill for to get you through the day, but it might be a symbol or a sign of something deeper. And get those things looked at and checked out. And above all, just make sure you get your annual checkups. Even if you're young, you're healthy, you're moving around, you've got no issues, no problems, no injuries. That's great, but the best medicine is prevention. And so getting in front of any issues or catching them early is your best bet to living a long, healthy life, and take care of things while they're small before they become significant. So I appreciate these questions, Samantha. James, interested in my health on this particular episode, but it tells me that there might be more interest in talking about this topic broadly. So we'll take that into consideration as we schedule the next set of expert interviews. If you'd like to follow me if you'd like to submit questions to me, my email is info at brianjmatos.com. Of course, you can also leave questions on this YouTube channel or on any of my social media sites. And you can visit brianjmatos.com for more information on this show. And you can subscribe to this playlist or to my entire channel to be the first to hear our next set of interviews and to hear my musings on your questions. Thank you all again for your interest. Talk to you again soon.